With that, we'll get started. Welcome to the October 24th, 2025 Workforce Development Committee meeting. My name is Wendy Strack, chairperson of the committee. And before we commence, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing the board's laws. Where the protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. The committee will meet by teleconference in accordance with Government Code Section 11123.5. Committee members will participate remotely from private, non-public sites. The public may participate remotely or in person at DCA headquarters at 1747 North Market Boulevard, Suite 186, Sacramento, California 95834. I will announce when we are accepting public comment on the various issues, and the meeting moderator will open the lines as appropriate. Each commenter will have 3 minutes to comment. Moderator, would you please provide the audience instructions on how they may participate during the meeting at appropriate times?
When public comment is called for, we will put a visual on screen asking people to raise their hands. For dial-in users, that means dialing *3. People will be given 3 minutes to speak, and I'll give you a 15-second warning before your time expires. Back to you, Madam Chair.
Thank you, moderator. I'd like to now call the meeting to order and ask Christina to call roll to establish a quorum.
Good afternoon. Wendy Strack.
Present, public member.
Eleanor Uribe.
Present, LCSW member.
Dr. Annette Walker.
Present, public member.
For the record, Dr. Nicholas Boyd and Justin Huft are absent. We have a quorum.
Thank you, Christina. Board staff, would you like to introduce yourselves, please?
Yes, thank you. Steve Sodergren, the Executive Officer of the Board of Behavioral Sciences.
Roseanne Helms, Legislative Manager for the board.
Shelley Ganaway, Board Counsel.
Sarita Risso, Special Projects and Research Analyst for the board.
Sounds like it might be it in the room there. Oh, sorry, did I cut somebody off?
No, I'm sorry, that was it for board.
Okay. Now is the time for the public to introduce themselves if they would like, and this is voluntary. Is there anyone in the in-person audience that would like to introduce themselves?
Good afternoon, Shanti Ezrin, California Association of Marriage and Family Therapists.
Thank you.
That's all.
Okay. Moderator, is there anyone online that would like to introduce themselves?
Several. We're going to start with Sarah and then go to Ben. Sarah, we're sending you a request to unmute your microphone.
Good afternoon, everyone. Sarah Carrasco, Licensure and Compliance Specialist with William Jessup University.
Thank you. Next, Ben, and then followed by Elise. Hold on.
Thank you. Good afternoon. Ben Caldwell, MFT.
Elise, we're sending you a request to unmute your microphone. Then we're going to ask Leah. All right, Elise, we're going to send you another request to unmute your microphone. We're going to move on to Leah. We'll come back to Elise in a moment. Oh, Elise, are you with us?
I hope so. Yes.
I hear you.
Perfect. Elise Springer, LMFT, Volunteer Policy and Advocacy Chair at Postpartum Support International, California. Thank you.
Thank you.
Leah Brew, LPCC and Counselor Educator.
Fantastic. You beat me to it. Next, Dr. Betsy.
Hello?
Are you, Betsy,
Hello?
are you with us? I hear you.
Yes. Great. Good afternoon, everybody. Dr. Betsy Perez, Cal State University, Northridge, Counselor Educator.
Thank you. Chad, you're next. Hold on just a moment, please.
Hello, Chad Tynan, LMFT, Director of Clinical Training at Golden Gate University.
All right, Stephanie, you're next. Hold on, please.
Good afternoon. This is Stephanie Gabler, licensed MFT. Thank you very much.
Welcome. And that's the last of our requests online.
Okay, thank you. Moving on to our agenda items. The first agenda item is discussion and possible approval of July 31st, 2025 Workforce Development Committee meeting minutes. Does any member wish to remove or edit any of the items from the consent calendar? Dr. Walker.
I don't want to do that. I wanted to make a motion at the appropriate time.
Okay.
No edits.
Seeing no other hands up from committee members, I think this would be the time now for a motion.
Okay. Thank you, Madam Chair. So I'd like to make a motion to approve the Workforce Development Committee meeting minutes of July 31st, 2025.
Thank you. Do we have a second?
I'll second it, Eleanor Uribe.
Okay, great. Are there any comments from in-person attendees?
No. No, sorry.
Okay. Are there any comments from those online?
All right, we have a motion for agenda item 3. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few seconds to see if we have a request for public comment. Seeing no requests, do you wish to continue with the motion?
Yes, please. All right, Christina, take the vote, please.
Wendy Strack,
Yes.
Eleanor Uribe,
Yes.
Dr. Annette Walker,
Yes.
motion carries.
Okay, thank you. Moving on to item 4, presentation on other state jurisdiction education requirements for licensure. Steve, will you provide us with the overview?
I will. And this presentation really, I just like to preface this by saying this is really just was a basic overview of 3 jurisdictions and California, just to see what other jurisdictions have out there for their education requirements. It's labeled as a presentation because I think really the discussion that will ensue with our item number 5, which is the actual requirements for LMFT education, this will come into play. So really from this presentation, I wanted to give you some things to think about. And as I say, it was a real basic review. There could be more that can be done as we venture into this process of looking at education requirements. I think we'll be returning to looking at more in depth some of the national requirements that are out there. So. In this presentation, really, in the background section, wanted to kind of set the tone of why we're even looking at this, kind of revisit that. And, we're looking to streamline the education requirements because currently right now, for California, in-state applicants have to complete all their education requirements before they're issued a registration if they've graduated after 2012. There's a different play for out-of-state applicants. There's greater flexibility, and they may remediate several educational deficiencies post-degree, including some cases after they've received a registration. So that's one of the things that we're trying to look at. How can we streamline that or make that more equitable? Additionally, we have questions about labeling or segmenting the degree requirements from in-state and out-of-state. This has been caused kind of an issue internally of trying to determine if a if a education program is in-state or out-of-state, especially with the more introduction of hybrid distance learning programs. So that's another thing that we're wanting to really concentrate on as we go through this process. Another important consideration is whether the requirement that a qualifying degree should be integrated in marriage and family therapy. Right now, California requires an integrated degree. There are 12 semester units that specifically must be in a marriage and family coursework, along with additional coursework that's outlined in the statute. Not all of the additional coursework has a defined content or unit requirement, but the program must incorporate all the requirements into their degree program to be acceptable. And then currently California education requirements provide flexibility for institutions to kind of design a program that will prepare students for licensure. But the flexibility is nice, but it does create some challenges in determining whether a degree meets California education standards. A full review of the programs and syllabi, and that's usually what has to be done. And even at that case, it's kind of we do have a lot of questions of whether something would actually meet an integrated course or integrated program. So those are some things to think about as we move through this process. The 3 states I looked at were Oregon, Ohio, and Texas. The reason I chose those, they're structured similarly to the California licensing framework, and they really do have clarity in their education requirements. And when I was looking at these, we were looking at accreditation, title of degree programs, unit requirements, course content, and remediation pathways for that. As I'll go through this, just for time, really, as I said before, really quick presentation. There's some material, hopefully you could go back. We have included the actual statutes and rules within the memo, so that might be a touch point later on. We can always go back to those to look at when we're talking about especially actually the degree requirements, educational requirements. So the first thing I have on the memo is that in-state versus out-of-state. That's something that is really unique to California. In each of the other states, they don't actually use a requirement for in-state, out-of-state. It's just looking at quantifiable course content, competencies, and program accreditation to determine if a program is acceptable for a license. The unit requirements, that's pretty standard across all. It's the 16 to 90 semester unit graduate degree standard. So 60 to 90 degrees in the graduate program is pretty standard across at least these 3 boards. I know there were some, I think it was Illinois I was reviewing. We did not continue on with that review. They do actually offer, I think it's still around a 45 degree content. But I think the 60 and 90 degree content is something that we would want to definitely maintain. And in each of those, there are similar allowances for when the older programs were conferred. They do point out that depending on each state had its own, I guess, framework for when they considered an older degree that could actually be accepted with 45 to 48 units. Similar to California that we have currently in our pre-2012 requirements. For degree designation, California specifies acceptable degree titles, and it names out a whole list of degree titles. And in contrast, Oregon and Texas, they will accept degrees in related behavioral sciences fields, provided that they substantially meet the marriage and family education requirements and content. Ohio was a little more restrictive. They require a degree to be explicitly titled as marriage and family therapy, and then it has to be grounded in a systemic theory of marriage and family therapy. In accreditation, there's another part of this. We'll be talking about accreditation in another item on the agenda. Really for this, I think we're looking at, we do recognize for the LMFT degrees COAMPT, the Commission on Accreditation of Marriage and Family Therapy Education. I hope I got that right. COAMFT, we'll say from now on. We do recognize COAMFT as an accrediting agency that if a degree is from COAMFT accredited program, it is acceptable. The difference lies in the emphasis we place on that accreditation. California, really, we say it has to be accredited by COAMFT or other accreditation agencies. But some other states will actually allow a COAMFT accredited program to basically, if it's from a COAMFT accredited program, you can pass go. You meet the education requirements. For us, we do recognize that accreditation, but we still review the program. So we will have further discussions on that in another item coming up. Content. All states require graduate level study emphasizing systemic practice with couples and families. Differences between California and other jurisdictions arise primarily in how education content areas are prescribed. California in-state education requirements are the most detailed in identifying the specific competencies that must be integrated throughout the degree program, but they are less prescriptive when defining the number of units required for each defined content area. And then California requirements for out-of-state degrees are more prescriptive and clear concerning the required units required for each content area than its in-state requirements are. So in contrast, the other states define competencies to be integrated with content areas and clearly specify the numbers of hours required for each. So it's more quantifiable. The other states we were looking at, that content was really, it was more quantifiable than California. As for remediation, Oregon, Texas, and Ohio permit post-degree coursework to address gaps in content of practicum experience. And California, we do allow remediation of coursework for out-of-state degrees through additional graduate level courses, but generally we do not permit post-degree practicum remediation except under some sort of under some provisions for out-of-state applicants. In the conclusion, I have overall California LMFT education requirements are consistent with the national expectation for the threes that we looked at. I shouldn't say national expectations, but consistent with the three that we looked at. I think they are representative of what's out there nationally. The California in-state framework is the most comprehensive in identifying the competencies that must be integrated throughout the degree program, yet it is less prescriptive in defining the unit requirements for each content area. And in contrast, California's out-of-state requirements align with other jurisdictions in prescribing the unit requirements for educational content areas, but are more comprehensive in identifying actual competencies within those. So in that brief overview, there's some things that I just wanted to put in here as consideration as when we move forward, what we should be considering when we look at the framework that we will be proposing. The committee should consider amending the committee should consider if they want to amend the current education requirements to remove in-state and out-of-state designations and rely on degrees that substantially meet the education requirements that are set forth in the statutes. The committee should consider removing degree titles and instead accept degrees that meet the educational requirements. The committee should also consider formally recognizing the degrees accredited by COAMFT or CACREP as meeting the educational requirements. That means if we want to consider those, if they have that type of accreditation, they are automatically accepted as meeting those requirements. The committee should also consider identifying minimum unit requirements for each content area and revising the competency standards to provide a broader, more flexible descriptions. And lastly, I think the committee should consider amending the current remediation content to offer a broader range that can be met through remediation coursework, graduate coursework. that is the presentation. And like I said, it was a really basic, quick overview. There could be a lot more that goes into this, and I think as we move forward in this conversation, we will dive back into looking at other, possibly other states, and looking for examples that with more specific focus on more focused areas. So, are there any questions?
I'll look to my colleagues for questions. Anything so far? Dr. Walker.
Yeah, not so much as a question, but just a comment. I appreciate your thought process in putting this together, Steve and staff. And I liked the idea of bringing a framework forward. I think that'll really help us see the layers. So yeah, well done. Looking forward to seeing what's next.
Same here.
Okay.
Same here. I appreciate the report and the comparisons, and there's a lot of thought that has gone into this. And I know, I mean, we still have a lot more work to do, but thank you for presenting that, Steve, and those who prepared it.
Thank you. And for me, I think it really highlighted, I can already, ideas are already percolating about where some flexibility could be integrated to make the pathway more clear and accessible, sort of without compromising eventual patient care. So I think well done. Now we'll go to comments. Are there any comments in the room?
Yeah, there are.
Hello, Shanti Ezrin with CAMPT. Steve, I'll start just by thanking you for doing all of the research with a couple of the other states here and going through some of the education requirements that you found, and also appreciated seeing some of the recommendations for consideration. And after reviewing them, wanted to offer some of our initial thoughts on each one. And want to first preface some of the comments that I'll share here in a second by saying that we've looked at each one of these recommendations really of the lens of ensuring consumer protection and, of course, balancing that with lessening any unreasonable barriers for applicants to get licensed. So with that being said, a couple of the recommendations there that you had reviewed to remove in-state and out-of-state designations, removing degree titles to focus on degrees that meet education requirements, we think are great recommendations for consideration. We also think amending the current remediation content to offer a broader range is a great recommendation to consider as well. However, on the recommendation pertaining to relying on accreditation to determine, whether a degree meets educational requirements, we are mindful, of course, of BBS staffing and workload capacity, but there are some concerns we have about formally recognizing degrees accredited by COAMFTE or CACREP, I think that's how we're saying it, as meeting educational requirements. And some of these early concerns that we have include potentially adding any unintended consequences of deviating from current practice of evaluating programs beyond just accreditation, and then also putting non-COAMFTE or CACREP degree programs under extra scrutiny. So just to offer a bit of context for this recommendation, I'll share a statistic from Congresswoman Julia Brownlee's press release. And that statistic states that on average, 30% of LMFTs do not graduate from COAMFTE programs. That's a national number. And in California, that number actually rises up to 95%. So lastly, I think there was one more recommendation in there, and while we don't have a hard position on the unit requirements for specific content areas, kind of just reading between the lines there, if the intent is to ensure the quality of content, we do think that this can be addressed with more detailed competency descriptions that's listed in the recommendation, as opposed to setting specific unit measurements. Thank you.
That's all for in the room.
Okay, moderator, do we have any comments online?
All right, now is the time to raise your hand for agenda item 4. Please do so by tapping that hand button at the bottom of the screen. Dial-in users, dial *3 to raise your hand. And first, we're going to hear from Ben Caldwell. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Thank you. Good afternoon, Ben Caldwell, MFT, and I want to second what Dr. Walker said as well as what Shanti just said. First of all, in thanking Steve and staff for framing this discussion the way that you are. It's nice to have it broken down into these different sort of discussion areas. I think that'll make it a lot easier to process what is in totality a pretty big discussion. In regard to the particular point about accreditation, I know we're going to hear about program accreditation a little more as the meeting goes on today, but there is some concern about recognizing either of the accrediting bodies as sort of automatically meeting California's curriculum requirements, which traditionally have been well attuned to the specific needs and populations of the state of California. So they do serve a strong public protection purpose. And as Shanti was saying, it may be best to kind of continue in that vein. There's also particular concern when it comes to recognizing CACREP accreditation. My understanding is that around the country, there are only like 10 or 11 jurisdictions that do. You'd be reopening kind of a can of worms that last came out in the discussion around LPCC licensure back in the day. I know Dr. Brew is with us today. She can speak to this as well. But there's a pretty big philosophical disagreement between, I'd say, a lot of MFTs and what CACREP suggests in its standards, where those CACREP standards suggest that the profession of marriage and family therapy is kind of a subspecialty within counseling, as opposed to being a separate and independent, fully fledged profession. So like I said, I know we're talking about these topics a lot more, but I think it's important to have that as context here at the beginning, because that would raise significant concerns, I think, in a lot of MFT quarters. Thank you.
All right, next we're going to hear from Dr. Betsy Perez. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Okay, just making sure that I'm heard.
I can hear you. Go
Great,
ahead,
thank you so
please.
much. Before I begin, I just want to make sure I know that this was, first of all, thank you to Steve with that report. Is this also in regard to the LPCC licensure, or is this only in terms of the MFT?
I mean, similar concerns will be carried over until our LPCC discussion, but that will be, we're doing the LMFT first, but I mean, almost the similar topics will be carried over to that discussion later on. So if that does that make sense? Or?
Yes, a follow-up would be if it would be appropriate then to make a kind of comment on the LPC now or wait till a later time.
How I would suggest waiting until we talk about item 5, where a lot of the we're going to be talking about the LMFT framework of their education requirements, and a lot of that's going to dovetail with LPCC eventually.
Okay, thank you. I'll wait.
And then I'd also like to offer, just, I mean, I'm sure everybody understands this, but if you do have concerns, comments, questions, please, we are always available, myself or Roseanne, through email, definitely, because we do want to get this as a robust discussion and get as many possible opinions and suggestions that we can get. So it's going to be a very big conversation. It's going to kind of go all over the place, I think, but you can always email us too. So please remember that.
All right, next we're going to hear from Leah Brew. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hi, Leah Brew, LPCC and counselor educator. So Ben, thank you for setting me up. Just to make it clear, CACREP does look at counseling as the foundation And that is usually about 48 units and then 12 units of a specialty. About half of the country has that same alignment. And I just wanted to make it clear that KCREP has many specialty areas. One of them is MFT, and should we decide on acknowledging accreditation, then for the MFT, it should be the MFT area. Whereas when we get to the LPCC, I think we could broaden it to really any of the specializations. Secondly, I support using accreditation because it's not that you're still going to have to make sure that everybody meets the content areas that are unique to California in terms of like child abuse reporting and those types of areas, suicidality. But I think it would be easier if you acknowledge accreditation as saying that it meets the major content areas, notwithstanding what the MFT concerns are about KCREP's MFT specialization. The content is there and the standard is way higher than the BBS. And if all the content seems to match, at least you can approve the degree, which means that nobody has to make up the degree, but they can make up just those individual CEUs, so to speak, where we just have like 15 hours here and 7 hours there. Thank you.
All right, next we're going to hear from Sarah Carrasco. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Yeah, we just wanted to thank Steve and let you know how much we appreciate the report and especially how easy the information was to understand and then thus understanding the reasoning behind the recommendations. And we also agree that streamlining that is in-state versus out-of-state requirements will ensure equity, and we look forward to the board's future discussions. One thing that I wonder, and I just wanted to throw that out there, is not necessarily with accreditation, but approving degrees that are existing degrees, such as with our university, if it gets reviewed and all the syllabus gets reviewed, if we could be approved to where every applicant's application doesn't have to be scrutinized or gone through, that might be something that would help efficiency down the road also. Thank you.
Thank you. And those are all of our requests for public comment at the moment.
Okay, great. Thank you. All those comments were great information to share with us and great things for us to keep in mind as we go forward through this process. So thank you for that. Steve, is there anything you want to add or close with before we move on?
Oh, no, just thank you for all the great feedback. Sarah mentioned about the approval process. That is something that is kind of on our radar for these further discussions later on, is possibly implementing a kind of a formal process like that, where we can look at approving certain programs so that we're not having to review every transcript. But that's a big process that'll take a lot of discussion and a lot of work. So, but that is on our radar. Thank you.
Thank you. And then I think we're going to take item 6 before item 5, Steve, because I think we have that maybe informing item 5 a little bit. So, so we'll move on to item 6, the presentation on Commission for Marriage and Family Therapy Education and Commission for Accreditation of Counseling and Related Educational Programs Accreditation Standards. Steve.
Yes, thank you. We've already had this discussion, it sounds like, on some of the comments, so it's going to be a very brief. Once again, this is to kind of bring attention to the different two major, not major, but two prominent accreditation agencies that are working with LMF. They review graduate programs to make sure they meet the standards, hopefully rigorous standards in quality and competence. And with these while the process of accreditation could strengthen program quality, it can also create additional burdens for schools and may limit innovation in training approaches. California's current educational framework is intentionally designed to allow for flexibility and encourage innovation in curriculum and development. That's where we get the integrated degree program. Currently, applicants for marriage and family therapists or licensed professional clinical counselors must hold a master's or doctoral degree in an institution accredited by a regional or national institution accrediting agency recognized by the U.S. Department of Education or one approved by the Bureau for Private Post-Secondary Education. For LMFT applicants, a degree from a program accredited by the Commission a Commission on Accreditation for Marriage and Family Therapy, also known as COAMT, is also accepted, as we previously stated. In most other jurisdictions, eligibility for LMFT and LPCC licensure is also based on regional and national accreditation, with additional recognition for COAMT for MFT programs and CACREP for counseling programs. CACREP, as was mentioned before, does have also some states do recognize CACREP under their marriage and family counseling subset. So the COAMT and CACREP, I think, are widely regarded as the most comprehensive accrediting bodies for these types of educational programs. I could be wrong. But some states like I said before, accept degrees if they're from COAMT or CACREP outright. We currently don't do that. Both of the accrediting agencies have developed specialized standards for marriage and family therapy and professional clinical counseling. And really, I'm just going to go through a quick review of each of those. The COAMT was established in 1975 and began accrediting programs in 1978. And its mission is to promote best practices in marriage and family therapy education through the establishment of review and revision of accreditation standards. COAMT accreditation emphasizes outcome-based education, diversity and inclusion, institutional resources, program effectiveness, and clinical training. And effective January 1st, 2020, adopted standards organized into 10 foundational curricular areas, also known as FCAs, which include relational and systemic practice, clinical treatment, multicultural and underserved communities, research, ethics, lifespan development, mental health diagnosis, community collaboration, and teletherapy preparation. You can see in the memo, it lists them out with the unit requirements that are required for the accreditation. In addition, the COAMT requires a minimum of 300 hours of direct clinical contact with at least 100 relational hours and 100 hours of supervision, half of which must be focused on relational or systemic supervision. Now for CACREP, CACREP was established in 1981 and they accredit master's degree programs in 8 specialized areas. CACREP's vision is to promote excellent and professional counselor preparation through leadership and accreditation. Its current standards, updated in 2024, outline 8 foundational curriculum areas: professional orientation and ethics, social and cultural identities, lifespan development, career development, counseling practice, group work, assessment and diagnosis, and research and program evaluation. Students from CACREP accredited programs must also specialize in one of 8 areas, including clinical mental health counseling, marriage and family therapy, marriage and family counseling, school counseling, and then there's 5 other types of specialized areas. CACREP requires both practicum and internship experience. The practicum must be a total of 100 hours, including 40 hours of direct service hours, and an internship. They must complete an internship that includes 600 hours with 240 indirect client services. So kind of blazed through that because I want to get to the main conversation here. So as we know, as you already heard, there's a lot of conversation around accreditation and a lot of thought. And so we will definitely revisiting this some more, but you do have the standards there. I would say take some time to look through those for future discussions. And so the key questions that we're looking at from this presentation and carrying on is should KCREP be formally recognized as accrediting agency for LMFT and LPCC licensure? And should we consider COAMFT or KCREP accreditation as sufficient to meeting educational requirements for LMFT or LPCC licensure registration? Just to note too, just to give you some data in there, we do have currently the board term, I'm going to use recognizes 106 LMFT degree programs, of which 11 are COAMFT accredited. So not a lot, as was kind of mentioned before. An additional 3 LMFT programs were accredited by KCREP. And for LPCC pathways, the board recognizes 113 programs, 20 of which are KCREP accredited. So that's kind of what we're looking at with the current programs that we've reviewed and have deemed applicable for licensure. I'm open for any questions, if there are any.
Okay, do we have any questions from board members? Not yet. I think we might be interested in hearing from our audience participants today. Steve, any comments in the room there?
Yes.
We have one.
Hi again, Shanti Ezrin with CAMPT. Steve, thank you again for the review of this one. And just for the sake of not being redundant, because I think I spoke to at least the second question, the previous item, I'll just speak to the first question here, if KCREP should be formally recognized. And I'll start by saying that we at CAMP generally support efforts to help remediate the workforce shortage and remove unnecessary barriers while still ensuring consumer protection. So that being said, we typically would lean into greater access and expanding degree programs, but we just haven't had time yet to fully assess KCREP background and its all of its educational standards. So thank you for including that in there. We'll definitely take it back to our team and take a deeper look. And I'll also say too that just really appreciate hearing from folks online today about their thoughts on this, and I'm sure they might have more on this item. We're taking notes on those, and that will be part of our review back with the attorneys before providing more input on both of these consideration questions. Thank you.
Thank you. And that's it for in-house.
Okay, moderator, any online comments?
All right, now is the time to raise your hand for agenda item 6. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3. And first we're going to hear from Leah Brew. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hi, Leah Brew, counselor educator. So we have a program that's both MFT and LPC, and but we're not accredited in the MFT place. I just wanted to make sure that as we consider, if we consider accreditation, not that we have to require accreditation, that's very different. There are many states that require accreditation, but if we allow it to be something where the BBS doesn't have to review the content of the degree, then I wanted everyone to know that one of the specialty areas, MFT, has 14 different items. And so as, for example, CAMPT takes a look at the KCREP accrediting standards, they have to meet all the base standards of the entire accreditation piece, and then the additional 14 standards on top of it. So it's a little bit different than the way COAMFT is structured, in that MFT isn't required to be integrated in every class, but many of the areas are integrated because they do specific like theories and models of marriage and family couples, principles of assessment and case conceptualization from a systems perspective. So it's all in there, and it's pretty extensive. And yeah, I think that's it. I just wanted you to look at page 27 in addition to the other standards. Thanks.
Thank you. Next, we're going to hear from Ben Caldwell. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Thank you. Good afternoon, Ben Caldwell. And as Shanti was saying, I don't want to be redundant. I've already kind of said my piece about the accreditation standards. I do think it's important that MFT programs be an integrated MFT program, be MFT throughout. But it's a bigger discussion that I know is going to take more time. My question really is kind of process oriented. For Steve and staff, what's the best way, and committee too, what's the best way for you all to get additional information, additional input from stakeholders, from faculty at different universities? Is it going to be through future participation at meetings like this? Do you want feedback through the MFT consortia? What's the best mechanism for that? And what's it going to look like, kind of the process of getting to various decision points? Anything you could share about that? Thank you.
The way I envision it is both, long story short. So we will start out of this meeting compiling various drafts based on focus areas. And so what I envision is once we have the draft, we can get participation or feedback either through these meetings or by sending it out to the consortia, sending it out to educators, asking and soliciting feedback there, because we really want all of the feedback that we can. We don't want to put up any, not everybody's going to agree on everything, but we don't want to put up any unnecessary barriers while we're doing this that can't be met. But we want to make this as comprehensive as possible and get as much input as possible. So it's welcome from wherever we can get it.
All right.
Sorry, moderator, I jumped ahead of you. Sorry.
By all means.
Oh, were there any other comments? I'm sorry.
We had a hand up and it's disappeared. Oh, it's back. Hold on just a moment. Dr. Betsy Perez, we're sending you a request to unmute your microphone.
Good afternoon, Betsy Perez. In terms of the KCREP accreditation, I just wanted to second Dr. Brew in really looking at the specific requirements that KCREP puts on programs for each of the specializations. I'm here specifically in talking with the school counseling specialization. At this moment, there really isn't a pathway for the school counseling track to take. I believe it is the assessment and diagnosis class outside of the order of coursework, which creates a barrier for folks who have a school counseling specialization to be eligible for the LPCC licensure. So really just kind of saying my piece for the need for flexibility in course sequencing and the impact this has on behavioral health workforce as schools are becoming, or as K-12 kind of evolves into needing more school-based mental health professionals. So allowing approved coursework to be completed in a non-sequential order and permitting fulfillment of LPCC educational components independently from the PPS credential would kind of decrease those barriers, and the changes would maintain the integrity of the licensure process while improving accessibility, reducing delays, and expanding the workforce to meet urgent mental health needs. So I just also want to end with thanking you for continued efforts to ensure professional standards and public safety.
Thank you. And that was our last request for public comment.
Okay, thank you. Again, a lot of really good feedback, and I think the question, Roseanne, about how and when we're going to bring in feedback from the professionals and educators and schools, I think all of that becomes a really important part of helping us put together, the best stuff we can for this, that meets the needs, provides flexibility, but still protects patients down the road. So I know you're always super great at doing that, but the comments about making sure that we're having feedback at the appropriate times are very valid. So any other comments from board members? Dr. Walker. Oh, sorry, Eleanor, and then Dr. Walker. Sorry.
No, I was just curious because it sounds like there's a lot of work still to be done by doing, I guess, focus or process groups, and then, taking out the kinks and making a lot of decisions. So do you know roughly what the time frame is for this, Steve?
Oh, it's going to be a while.
You'll kind of see when we do the next item what the extent of this is. But yeah, it's a couple of years process probably.
Okay. All right. Thank you.
And I had the same question. So thank you, Eleanor.
Okay. Seeing no other questions at this time, should we move back to item 5? Discussion and possible action to make recommendations regarding education requirements for licensed marriage and family therapists. And Roseanne, we're back to you.
Yes, so this is kind of where we discuss a very, very preliminary framework just for LMFT, a little bit of background. So the amount of work that needs to be done by this is so extensive that we've kind of split this into small parts, and we're going to even have to split it into smaller parts. As Dr. Walker suggested at the last meeting, is we need to break this up into tiny pieces to make it manageable. So we're going to start by discussing LMFT education requirements and kind of get a handle where we're going on that. And then the plan is also to revamp, if needed, the LPCC requirements, and then also look at the LCSW requirements. So it is a very large project. The last time we undertook any kind of educational review started in about 2007, 2008 for LMFTs. It was a couple of year process that culminated in SB 33 running and passing in 2009, which gave us the LMFT education requirements that we have today. So you can see kind of the extensiveness of it, what it was then, and now, over 15 years have passed. So it's really, we felt the time to look at it again. So that's where we are now. And we talked about starting this project a little bit at the last committee meeting, because there's some certain things that have that are kind of showing a need to be updated. We have certain degree pathways that are different. There's some questions about how integrated degrees are funded in-state and out-of-state as time has gone on. In 2008, 9, 10, it was a lot more clear what's an in-state versus an out-of-state degree than now, where you have people going to school online, or universities that might have a campus here and but be headquartered in another state. So we get all kinds of questions that can make the licensing process and decisions about them pretty complex. So what we would like to do is have a very clear, streamlined set of education requirements that's not vague or overly complex, that's fairly simple, that's easy for everybody to understand. That helps the board, that helps our, when interpreting the law, that helps our licensee or potential licensees and schools when trying to understand the law. So that's kind of the goal for everyone. So you're going to see today, we have one attachment, attachment B, that you saw at the last meeting that summarizes our 3 current out-of-state LMFT pathways to licensure. And then we have attachment A, which is really kind of the key focus of the discussion today, which is a very, very rough preliminary proposed outline of what a new LMFT education framework could potentially look like. That needs a lot of work, but it's kind of meant to get the discussion started. Before I get started, I also wanted to draw your attention to, because aside from the information from out of state and accreditation that Steve mentioned, we also had done a survey at our last meeting. We presented the results where we had asked educators and student registrants about where additional emphasis might be needed in LMFT education. And so that include areas such as treatment planning and interventions, trauma-informed care, assessment, diagnosis, and prognosis, and substance use and co-occurring disorders. And that survey also asked students and educators about their readiness to serve diverse populations. And as you can see from the results that I've outlined in the memo, there is some shortfalls. 24 to 32% of LMFT educators felt students were fully prepared to serve LGBTQ ethnic or racial minority clients. There was some concern about being fully prepared to serve rural populations and rural communities. So the surveys we did were limited. We did not have a huge volume of response, but I would take the information as feedback and suggestions. And I've included the surveys as well. So it's just something else to keep in mind as we go through these discussions. All right, so now I'm going to talk about attachment A, which is the proposal. And so what it does is it consolidates all of the LMFT education requirements into one single section right now. Like I said, it's in outline form. It's only for discussion purposes. It's not a final proposal. It's just meant to initiate dialogue and collaboration between board, educators, and we hope other stakeholders. So there's some certain key features of the proposal. As written, it applies to all applicants regardless of where their degree was earned. So it does not rely on determining whether somebody is in state or out of state. So that's one thing. The integrated degree requirement, it has states that a qualifying degree must be a single 60 semester, 90 quarter graduate level integrated degree program from an accredited or approved school or a COAMT approved program, as that's what we require now. We have removed specific degree program titles, and part of the reason for that is if we're not going to look at in-state or out-of-state, it's going to be very hard to dictate across the country what MFT programs call their MFT master's programs. We kind of had all the California schools on board, probably won't be able to do that nationwide. So that was the reasoning behind that. So instead, we looked at some of the other states' characteristics, and what we've kind of drafted here is that the qualifying degree must be marriage and family therapy or a related mental health field. It incorporates specific principles through its curriculum and must contain 6 semester units of practicum with face-to-face counseling experience. So these particular requirements in that part are meant to represent the core structure of the degree that may not be remediated. The degree in its core has to have that feature. That's a deal breaker if it doesn't have it. Next, I kind of grouped the next set of required content is coursework that must be taken at a graduate level, and some remediation is required there. We're having kind of an issue, not so much with MFT, but particularly with LPCC, in that if somebody is missing a particular piece of coursework and it can't be remediated, then it basically throws out the whole degree. So like right now with LPCC, if you don't have assessment or diagnosis in your qualifying degree program, then your degree is out. So the question becomes, what are we comfortable with remediating, and what is absolutely must be contained in that graduate degree, and then delineating what's acceptable. So the way that it's drafted right now is Each of the required content areas must be covered in the degree program, but the extent to which is covered is not specified. And then if the required unit thresholds are not met, deficiencies must be remediated through graduate level coursework. So I've included in that category things like assessment and diagnosis, human development, cultural diversity, law and ethics. We're going to have further discussion here to determine not only what topics fall under this and to clarify acceptable parameters for remediation. And we want to strike a thoughtful balance here because we want the degree to have the integrity that it's meant to be an MFT program, but we don't want to disqualify applicants due to a single missing course. So the question becomes, how do we strike that balance in a fair way? The next kind of grouping you'll see of coursework are what I call supplemental course areas, where we allow remediation as continuing education, just not undergraduate coursework. And these are typically hour, not semester requirements, and they tend to be applicable to all the license types. So courses such as child abuse, where we require 7 hours, substance use, aging and long-term care, suicide risk, telehealth. And what I'm kind of envisioning with these is we take a look at each one individually, determine whether the coursework needs to be updated, and then sort of put those in our general board provisions and require all of the license types, all 4 of them, with some exceptions for LEPs if it's not applicable. We apply the requirement basically to all 4 license types uniformly and let them remediate it via CE if needed. All right, so that's kind of this course structure. A few other notes, because right now we have sort of a different set of requirements for pre and post 2012 degrees. I didn't do that, but we put in a legacy provision that basically any degree begun before August 2012, it still has to have all the content and the unit amounts, but it can be a 48 unit degree with the practicum requirement that was in place that we were required at that time. So it's a little bit of a streamlined approach where basically all the coursework has to be there, but you can have a 48 unit degree and the old practicum requirement, because there's really nothing you can do if you already have that degree to go back in time and recomplete it. It should be noted that we removed what is the current provision in law that allows all out-of-state degrees that come in with 48 units, they have to remediate up to 60, but we do let them remediate. We would no longer, if a degree was gained after 2012, we would no longer, and it was only 48 units, so all degrees, let's say, gained now that are only 48 units, they wouldn't qualify because they would not be able to remediate to 60. However, we now have a licensure pathway known as Path A that allows out-of-state applicants licensed for at least 2 years in another state to qualify without meeting all of our specific degree requirements. So if somebody's licensed in another state in good standing, Path A would still be available to them and they could still qualify via that pathway. Also want to make a note on course timing. The way that today's proposal is written, all courses that are required for licensure would need to be remediated before associate registration. Right now, we let people remediate things at different times. It gets really confusing for staff and licensees because the requirements aren't consistent across license types. So we're just, in order to preserve public protection, all coursework needs to be met before associate registration. I will say there's a little bit of a loophole there because we have what's called the 90-day rule, where basically if somebody applies for licensure within 90 days of graduating, they have basically, they can work until we grant their associate registration. So if we send them a deficiency for our coursework, they could still be working under the 90-day rule, but they're on a very limited 1-year clock to make up that coursework. I already talked about elimination of degree evaluation based on whether it's an in-state or out-of-state degree, and how that's become increasingly problematic. So want to talk about potential next steps. We, like I alluded to earlier, we recommend breaking future discussion items into small components to support thoughtful and collaborative refinement. So some of the potential areas that we're going to need to talk about, and I'm kind of envisioning a team of 2 to 3 subject matter experts to sort of help advise us, because staff, we're not really expert, we're not educators, so all of the specific what should an MFT practicum course look like, what components really need to be mentioned in there, what's not so relevant, what needs to be updated because, you know, that's not in line with the profession anymore. We really kind of need SMEs and educators to advise us on that. But that being said, some of the things that need to be looked at through more of a direct lens, qualifying degree content and practicum requirements, what does that look like? Graduate level remediation, what should be remediated through graduate level coursework? What does that coursework entail? What are the limits of remediation? What should the supplemental coursework requirements look like individually? So we'll need to individually look at child abuse, substance abuse, suicide prevention. Are those particular additional coursework items still relevant? Do they need to still be included? What should the content be? Does that need to be updated, or is it fine? And then once we kind of have all those things set, those standards set, another look, because it's really a delicate balance, isn't it? You know, we're talking about a one pathway to licensure. So is that attainable nationally? Are we going to be locking people out with a perfectly good degree? We want to make sure that we're maintaining high standards, but we want to take a look back at what we've done and make sure that, you know, we're not unintentional up any barriers or unintended consequences too. Pre-degree hours. This is another possible discussion area, and this could be included with this, or it could be included as a separate project, but examining as we go through this process, MFT trainees in practicum count pre-degree hours. So what are the supervision requirements and the requirements for the counting hours? Do those need to be revised in any way? And can we open that up to PCC trainees and social work interns? Then also some other things that we'd like to potentially do. Does this kind of open the door to allow us to have sort of a provisional associate registration concept where we formalize the 90-day rule and kind of have a provisional associate number to bring those individuals under the jurisdiction of the board, so they're not just kind of out there as they're not really students under their school, but they're not really under the board yet. So can we address that with this? And then finally, kind of all of this begs the question of, could we do some kind of formal approval of school programs so that that it helps sort of streamline, we recognize your degree formally. Right now we have sort of an informal process, but it's not set by statute. I don't know that we would be able to require it because again, we're accepting degrees from all over the country, but if a school wanted to have a formal approval, could we have a process for that? So that's another question. So lots and lots of questions, definitely interested in feedback and ongoing feedback. So I'll open it up now.
Thank you, Roseanne. Any initial questions or comments from board members?
No.
Seeing none. Any in-person comments?
Yes, we have one.
Hello again, Shanti Ezrin with CAMT, and I want to just thank Roseanne, you, and all of staff for your work on this and for providing this very helpful outline, because it really just makes the information a little bit more digestible and gives us a bit of a more clear direction on places to focus in on, because there is just a lot of information. And that kind of leads me to my next point, which is what we plan on doing next, which is sitting down, looking at each one of these components and diving deep into each one. We haven't had the time to do so yet, so I think everything that we've shared so far today kind of just hit on some of the initial concerns that we're seeing, but plan on coming to at least the next meeting or providing more of our thoughts via email between now and the next meeting. But one thing that would be really helpful and maybe you've already hit on this earlier and I missed it, but a question would just be if it'd be possible to provide us like a general timeline for how you see the future discussion going with each one of these components and how you plan on either prioritizing certain ones of the 7 that we heard from you today, or if it's just going to be all 7 as like the major starting point in the next meeting. So hopefully that question makes sense. We just want to make sure we're looking at the ones with the highest priority first, or all of them at the same time, whatever you are envisioning. Thank you.
Yeah, I kind of wrote it in my memo toward the end. I kind of laid out kind of what I'm thinking of in terms of various steps we can break this into, but I'm kind of hoping to get some feedback from the committee today. Kind of my thought is that we would start with the qualifying degree content and practicum requirements maybe for the next meeting, maybe also graduate level remediation, and maybe sort of consult with some SMEs and get some feedback on that. But I kind of want to see where the discussion goes and what the committee and the public's thoughts are first before we definitely decide on that.
That's it for now.
Moderator, are there any comments online?
There certainly are. We're going to start with Leah Brew. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hi, Leah Brew, counselor educator. Let's see if I can do this in 3 minutes. I have 7 items. One is for the MFT, I just want to repeat, you add the KCREP MFT specialty to looking at programs if you decide to look at accreditation to approve the degree, even though there might be other areas they have to make up. And because you hint to the LPCC, I think that any of the areas within KCREP would be appropriate to also be an LPCC if they meet all of those standards. I want to give a little information about when we put assessment and diagnosis in the LPCC. It was because when we started the degree, there were people who had menus of classes and it wasn't a coherent program. And we wanted to make sure that the programs that were there were like actual, like full-time faculty who focus on training students rather than just a whole bunch of part-time faculty teaching their one course. So at this point, it feels like LPCC is well known in the state, and it would make sense that we continue to do that. They meet at least, is it 10 of the 13 post 2012 of the content areas. The second thing is, in terms of remediation, it looks like you removed the 12 hours of MFT content. And I kind of find that problematic in reviewing different programs. The BBS is very generous in reviewing what fits for MFT content. But when I came to the state, I noticed that and we were just an MFT program, it was before the LPC. A lot of the students were seeing kids and never had a course in working with children. And I think 12 units should be required, and having something like definitely a family systems course and couples and or child should be added as part of that content. And then to do it like the LPCC, where they have to meet X number of courses out of this total number of courses. No pre-degree hours. Oh, I don't think that pre-degree hours should be included for the LPCC because many of our students are from out of state and they start their hours here, and even if they finish it, they can't get licensed in other states. And then finally, if you approve programs, you need to do regular audits because
15 seconds.
When faculty change, sometimes people get lax in certain content areas like the recovery-oriented care. So more audits would be needed. Thank you.
Thank you, Leah.
And we're going to make a quick announcement like we were supposed to at the beginning. Now is the time to raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand. And we're going to continue with Elise. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hello, good afternoon. Can you hear me?
Yes, go ahead, please.
Perfect. Elise Springer, LMFT, Volunteer Policy and Advocacy Chair for Postpartum Support International, California. I do want to acknowledge the board's thoughtful work in modernizing LMFT education and wanted to make sure to state and as you are considering streamlining requirements, it's vital that we don't overlook a population at greatest risk for preventable deaths, which is new parents. Right now, our statutes require LMFT applicants to complete coursework in child development, human sexuality, and suicide prevention, yet none of these courses consistently mention perinatal or maternal mental health. So a clinician can become licensed to treat families without ever learning how to assess postpartum depression, intrusive thoughts, differentiate between postpartum bipolar disorder, postpartum psychosis, or the grief of pregnancy loss. And meanwhile, California data shows that pregnancy-associated suicide has doubled, rising from 2.3 deaths per 100,000 lives births to 4.1 in just a decade. And that is women only, as the state does not currently track new fathers who die by suicide. According to the California Pregnancy Associated Review Committees, 83% of those deaths occurred 6 weeks to 1 year postpartum, and 87% of those who died who had a diagnosable mental health condition. Most of these cases are treatable, 98% potentially preventable. So we train therapists to understand sexuality and child abuse because these areas carry profound social and safety implications, but perinatal mental health deserves the same baseline recognition. There are 800,000 Californians becoming new parents, and many of them are falling through the cracks simply because their clinicians were never trained to recognize and don't even know that perinatal mental health is a thing. So they don't know to ask for an area that they don't understand exists. So including perinatal mental health training aligned with the Department of Healthcare Services Birth and Care Pathway and California Suicide Prevention Strategy would not overburden graduate programs. It would save lives and strengthen families and would make our workforce safer and more competent. And thank you very much for the time and considering this essential addition. Thank you.
Thank you, Elise.
And next, we're going to hear from Ben Caldwell. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Thank you, Ben Caldwell, MFT, and I apologize if there's background noise here coming through the microphone. Really appreciate the thoughtfulness of this discussion. I know that this is the beginning of the process, and there's going to be a lot along the way. I think it would be most helpful probably to me and other stakeholders in thinking about where to focus our energy and attention before the next meeting. If we could have some clarity about what that next meeting is going to entail. And Roseanne, I really like your framing of like, maybe for the next meeting, we could focus on just 1, 2, and 3 of the recommended next steps that you had talked about, because that gives us the opportunity to really focus in those key areas. But any direction you can give in that regard would be much appreciated. Thank you very much, and look forward to this ongoing conversation.
Thank you. Next, we're going to hear from Dr. Betsy Perez. Hold on just a moment, please. We're sending you a request to unmute your microphone.
Hello again, Betsy Perez, counselor educator. I apologize for jumping ahead in my previous comment, but wanted to make sure that the comment did come within this item. And so just to repeat that in terms of the school counseling track licensure route for LPC, the need is in recognizing the order of coursework and the need for flexibility in course sequencing, the impact on behavioral health workforce as more needs grow within the K-12 environment. Allowing approved coursework to be completed in a non-sequential order would decrease a barrier and permit fulfillment of LPC educational components independently from the PPS credential. These changes would maintain the integrity of the licensure process while improving accessibility, reducing delays, and expanding the workforce to meet urgent mental health needs across California. Thank you, and apologies again.
Thank you. And those are all of our online requests for comment.
All right, thank you. Again, another great set of feedback. There is a lot to do, but super excited that we have a lot of engaged folks along the way. Any comments or questions from board members? Dr. Walker.
Yeah, I echo what you just said. My heart is fluttering. I have the butterflies. This conversation has been so great today that I just want to personally thank our stakeholders online and in the boardroom. I appreciate you being here and being a part of this conversation very, 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 very much. So my question is to our board chair and staff, specifically Rosanna, I suppose. You've done a great job here breaking down this information. So I sincerely appreciate you taking the board and the committee members in this board's recommendations or suggestions to you. So I really, really wanted to note that. But looking forward, I guess I'm thinking of the flow of your work, Roseanne. Do you anticipating bringing back parts of this conversation, bits and pieces, at our future workshop committee meetings, or do you need more time in between to prepare? And I guess I'm thinking maybe not the next meeting, but the meeting after that. I'm just kind of curious to how your workflow is and what you're thinking.
Yeah, what I'm kind of thinking is that we kind of have a framework, and I need to put it in. It doesn't really look like drafting a law change yet, so I need to kind of put it in more of a format where it looks like striking out sections and writing a new one. So my thought is kind of doing that, and then what I kind of am envisioning, because I've kind of gotten this to a point where the framework is there, but some of the specific wording in terms of therapy concepts and what needs to go where. I would really like to consult with some subject matter experts. We have subject matter experts that we work with at the board on our exam development and things like that. So I kind of envision assembling like a team of 3 of them to sort of collaborate and advise on some of the really specific language. And then we can take the language back as a group and talk about it at these meetings and show our educators and really get feedback on that from them. So I was just kind of thinking, and what seems reasonable for the next meeting is I was thinking I could draft 4980.36 into more of a formal looking legislative proposal. It'll still be a very preliminary draft, and then having a few SMEs collaborate maybe on the first 2 numberings on the last 2 pages of my memo. So the qualifying degree content and practicum requirements. What really makes a qualifying degree? What is that core coursework? How do we word that? What's the core? And then the graduate level remediation requirements. What graduate level coursework do we want to include? How much? What should be included in that? I think that's a pretty big chunk to bite off, and it's a start. We might not even finish it at the next meeting, but to attempt those 2, I think, is reasonable. I don't want to go into the supplemental coursework requirements yet, because that's kind of a whole can of worms. All of those courseworks, like child abuse, substance abuse, need to be looked at individually in terms of their content. So I'm kind of thinking that the first 2 would be a reasonable task.
Okay, yeah, we're going to help you with that. I guess more specifically, I'm asking, do you see us continuing to bring this item back at every meeting? Is this a living agenda item, if you will? Okay.
It would be hard because we need the feedback as we go along. We don't want to get too far off in going down one road and the committee wants to go a different way. So I think it's important to bring it back to every meeting.
Yes, so to me, it's not so much of the direction. We can see that, and we'll work together on that with everyone in the room, all the voices that we've heard today. I'm just thinking of the time that it takes for you to meet with SMEs, subject matter experts, and things like that. You may not have time to do what you, quote unquote, your goal is intended by the next discussion. So just giving yourself some flexibility there.
Yeah, no, I think that I have time to do that between now and January. The next meeting is January 15th.
I think
So yeah, there's time. We might run into a little bit more of an issue like in March, April, when the legislature's in full swing, but right now the legislature's out, so I have enough time to do that.
All right. And I guess I should stay in my lane too, Madam Chair. You do a great job of putting this agenda together. I'm just looking at the bigger picture. That's all. Thank you for answering my questions.
No, your comments are well noted. Thank you, Dr. Walker. Eleanor, did you have anything?
I think I think just there's a bunch of different comments that are being made. So, how to integrate that as we continue to it's like discuss this and make sure that the different concerns are addressed. So
Okay. Great. And Roseanne, you don't need any particular actions from us, do you, on this?
No, so what you can expect for the next meeting is that I'll make the attachment A language look a little bit more like an actual section of law, and then we'll bring back some sort of a discussion and recommendations on under my recommended next steps, items 1 and 2.
Sounds great. Thank you. Okay. Looks like we're ready to move on to item 7, update regarding the Workforce Development Action Plan. And Steve, I think we're going to you here.
As you can see, we're really working on a lot of those items that I have on the plan. I don't know, maybe we can, I should have reviewed that, and maybe we can incorporate some of the additional educational stuff that we have talked about today into that plan, so we have it a little more comprehensive. I might include that, just thinking about that. So, but the plan and the attachments there, it kind of, we just as a highlight is remembered, we moved some of those items over to the Outreach and Education Committee. So you may see some items that were missing. So, and any questions?
Looks great on my end. Dr.
Great on
Walker,
my end,
Eleanor?
too. Yeah, great on my end too. Thanks, Steve.
Eleanor had disappeared off my screen, so we may have lost her. Did we lose her from the meeting?
Actually, we have lost quorum. She has informed us that she had to leave. So for the remainder of the meeting, it will change to informational only, except we will still hold public comment. We just won't have any discussions or action items from the committee. Thank you.
Okay, so we are probably on our last substantive item. So can we do public comment on this, and then we can, are we still good to take public comment on item 7?
Yeah, we can still do that.
Okay.
Oh, she's back.
sorry, it got disconnected. I closed a window I shouldn't have closed. Sorry.
Just got your text, sorry. Yeah, there's none in house. Sorry.
Okay. Are there any comments from in-person attending? Oh, you just said none in house. All right. My brain's starting to fall off on a Friday afternoon here. Are there any comments online?
All right. WebEx is open for public comment on agenda item 7. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few more seconds to see if we have a request for public comment. Seeing no request, do you wish to continue?
Yes, thank you. And Eleanor, since you're back, before we leave item 7 on the workforce development plan, did you have any comments on that? I didn't want to miss you in case you had.
No, I'm sorry. I don't have it this time.
Okay. Perfect. Thank you. Okay, moving on to item 8, suggestions for future agenda items. Do any board members have any additional agenda items for a future meeting? Okay. Seeing none, does anyone in the in-person audience have an agenda item for a future meeting?
No, none in house.
Okay, moderator, is there anyone online?
WebEx is open for public comment on agenda item 8. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a moment to see if we have a request for public comment. See request, you wish to continue?
Yes, thank you. Okay, moving on to item 9, public comment for items not on the agenda. As a reminder, the board may not discuss or take action on any matter raised during this comment section, except to decide whether to place the matter on the agenda of a future meeting. Do any board members have comments for items not on the agenda? Okay, seeing none. Do we have any in-person audience members with comments for items not on the agenda?
No, we do not.
Okay, and moderator, do we have any online audience members with comments for items not on the agenda?
All right, last call, agenda item 9. If you'd like to make a comment, please raise a hand by tapping that hand button at the bottom of the screen. Dial-in users dial *3 to raise your hand, and we will call on people in the order we have requests. We're going to take just a few more seconds to see if we have a request for public comment. Seeing no request, you wish to continue?
Yes, thank you. Our next agenda item is adjournment. Thank you everyone for participating today. As a reminder, our next board meeting will be on November 20th and 21st in Sacramento. And we hope to see you all then. Thank you so much.